Hey, this is Brad Butler with Jerry Henderson here at Clinician. Just want to spend a couple minutes talking about therapist documentation and efficiency. Jerry, we have the opportunity to speak with so many people and so many therapists across the country. One of the biggest things I hear about is how long documentation takes.
We had the opportunity to do a recent survey at one of our webinars. I'm not exactly sure on the exact numbers, but it broke down something like this. There's about 400 respondents in the survey, and they broke down about half and half people that use clinicians, EMR, and other EMRs. So we surveyed everybody, and we asked them, I think, 4 questions. And the questions were like, how long does it take you to do data entry, just the data entry piece, right? To do an initial evaluation, daily note, progress note, and correspondence to a referring physician. And it was fascinating because the results varied like wildly, right? We had people say it took them 5 minutes or less to do an initial evaluation. We had people say it took them 30 minutes or more to do the data entry for an evaluation, and everything in between, right? So we took those results, and on average, the clinician users were significantly more efficient than the non-clinician users. But even within those clinician user groups, there was still a lot of variance. There were still people who said 5 minutes or less, and there were people that said 30 minutes or more, right? And everything in between. So I thought, just for fun, I picked one of the therapists who was super efficient, right? She had 5 minutes or less on her initial evaluations, 2 minutes or less on a daily note. And then I took one of the super non-efficient therapists using clinician systems. Then I compared side by side the documentation. And I think that anybody looking at the documentation of the super efficient therapist would say it was better, much, much better. Told a better story about the patient, what established medical necessity better, had good rationale, it was clear what was going on, easy to review. And the non-efficient therapist was just totally the opposite. I couldn't really tell what was wrong with the patient, not a lot of functional information, difficult to follow, didn't really do a good job of establishing medical necessity, all those things we look for. So then you've got to ask yourself, what is it about this super efficient therapist that she can not only do a really efficient job, but do such a great job of documenting versus the non-efficient therapist?
Yeah. Well, Jerry, thanks for sharing some of that information. I know you've seen a lot of documents with a lot of different therapists and seeing really what's successful and what's not when it comes to that. So again, this is Brad, Jerry Henderson with Clinician. Thanks.
Thank you.